Wearing face masks became a widespread practice following the onset of the Wuhan coronavirus (COVID-19) pandemic, with many governments worldwide mandating their use in public. However, recent research has raised concerns about the safety of these masks, particularly surgical and reusable FFF types, which have been found to emit potentially harmful chemical compounds. A study published in April 2024 revealed that masks could release nearly 5,400 microplastic particles over 24 hours, with surgical masks emitting over 3,150 microfibers in just 1 hour. Researchers from Germany and Switzerland reviewed 24 studies involving more than 630 masks, including cloth, N95, and surgical varieties. They found that 63% of the masks released significant amounts of microplastics, nanoplastics, organophosphate esters, and polycyclic aromatic hydrocarbons, with surgical masks being linked to higher emissions of heavy metals, phthalates, and volatile organic compounds, VOCs, similar to textile masks. Some substances detected, such as per- and polyfluoroalkyl substances PFAS, titanium dioxide, TO2, and VOCs, were found to exceed safe exposure limits. A 2022 study published in also highlighted concerns about TO2, a potential carcinogen, calling for stricter regulations. Another recent study published examined 4 types of face masks to identify the presence of 31 plasticizers and assess how much of these compounds could be inhaled during use. Plasticizers, which are added to materials to make them softer and more flexible, were found in all mask types at similar levels. However, surgical and FFF2 masks, commonly used in Europe, had the highest plasticizer release rates, at nearly 4% and 5% respectively. The research was conducted by the Environmental and Water Chemistry for Human Health Group at the Institute of Environmental Assessment and Water Research in Barcelona, Spain. The researchers noted that most face masks are made from synthetic materials like polypropylene, polystyrene terephthalate, and polyester, with plasticizers added to enhance fire resistance, flexibility, and softness. Some masks also contained heavy metals, PFAS and VOCs. To simulate real-life mask use, the researchers conducted inhalation experiments using papier-mâché dummy heads, finding that higher temperatures, similar to human breath, increased the release of plastic additives. Release rates varied significantly, ranging from 0.1% to 95%, depending on the compound and mask type. Organophosphate esters and phthalates had average release rates of 1.0% and 1.2% respectively. Surgical and FFF2 masks had the highest overall release rates, while reusable masks had the lowest at 0.6%. N95 masks had a release rate of 1.2%. A particularly concerning finding was that a surgical mask released 95% of a compound called acetyl tributyl citrate, a potential endocrine disruptor. While the released plasticizer levels remained below established safety thresholds, the researchers emphasized that face masks represent an additional exposure pathway. The study cautions that even low levels of plasticizer exposure pose genotoxic, DNA damage, immunotoxic, affecting the immune system, and teratogenic, causing birth defects risks, particularly for vulnerable groups such as children and pregnant women. Additionally, plasticizers have been linked to declining sperm counts and potential fertility issues, raising concerns about their impact on future generations.